I want to say happy morning to every Deltan and all those living in Delta states. I want to use this opportunity to appreciate all Deltans and non-Deltans living in Delta state for the cooperation thus far. We are on day 8 of the lockdown, and I know that a lot of our people have been cooperating with the directive of government. Unfortunately, a few persons have tended to disobey orders, and I want to urge every Deltan from today onwards until the 14th day to please, for the sake of everyone, for the sake of humanity, to please obey the orders of government. Otherwise, you'll be caught off with the hand of the law. The lockdown order was given because it was necessary. It is also lawful because I've already signed into law a regulation which empowers us to take action against those who would disobey the lockdown order. That I want every Deltan to appreciate that it is for the public good. And for all Deltans who have cooperated with us and have sent messages of encouragement, I want to thank them. Delta State recorded its incident case yesterday, the 7th of April, 2020. That case is already been moved into one of our 4 management centers. And we have already started the process of contact tracing. I want to assure all Deltans that our health staff have received the best of training. They are in good spirit and ready to go. And I also want to use this opportunity to appeal to all Deltans to pray for our health staff and to support them to succeed. For those of us that have been watching the television, we can see that a lot is being done by other countries to encourage the health staff. And there is a need for us to support them and to pray for them at this moment when they are very likely going to be overworked and also will be in a position in the course of their work to expose themselves. But by God's grace, we are very prayerful and we hope that none of our health staff will ever contract the virus. Our health staff, however, want to make a very special appeal. This is the time for all health staff, particularly those trained and those that may be called up in the future for training and support, to please show all commitment and passion that is needed for the state and for all of us to win this battle. For the doubting Thomases, COVID-19 is real. It is not for the rich or for the poor. It could affect anybody. And I want to appreciate it if all Deltans will have this at the back of their mind, that anybody and everybody is vulnerable. Both the old and the young are both vulnerable. And if we're watching the television, we'll find that old persons have died. Yes, a lot more. The young persons have also died from the COVID-19. And I believe that by the special grace of God, if we all cooperate with each other and report on time, I pray that we'll have no death in Delta State. I want to urge us all to continue to observe the rules that we have put forth. Washing of the hands regularly with soap and water. And when that is not immediately available, use hand sanitizers. It's important that we stress the need for social distancing. Try as much as possible to be about 6 feet apart from the next person. And it's important that we observe this. We must try to refrain from using our hands, unwashed hands, to touch the eyes, the mouth, or the nose, because it's an easy way. If your hand is already infected, it's an easy way of getting the virus into your system. For those who have cough, please stay at home. And if you need to cough, cough into your bended elbow. And if you cannot do that, get a piece of tissue and then cough closing your mouth, but that tissue must immediately be discarded and your hands must be washed. For those who feel sick, having a fever, a cough, or you feel breathless, unable to breathe, it's important that you do not hide yourself at home. Call the following numbers. We had once released the numbers to each and every one of us, and those numbers have also been released to all our council chairmen. The numbers include, there are 4 numbers, and they include 080 31 23 0480. The second number, 080 31 23 0481. And the third, 080 31 23 0528. And the fourth, 080 31 23 0529. You can call any of these 4 numbers and you'll be directed as to what you ought to do. In the absence of this, call your local government council chairman, who will be able to direct you appropriately. Or call your councillor, who have been instructed by the council chairman, and they will also direct you on what to do. You may also call your doctor. But I want to urge that for those who have the symptoms, including fever, cough, and breathlessness, as much as possible, it is best to call these numbers or any of these persons. Or if you know the executive secretary of your local health authority in the council or the disease surveillance officer, call them. Because we do not want patients just running into every private clinic or patent medicine shop who may not be able to manage you or know exactly what to do at that moment. And we'll find that will begin to increase the level of transmission of the virus. I want to also urge all private clinics, when you see any case that has these symptoms, please contact the numbers that have so been called, or contact the Commissioner of Health, or the local government council chairman, or the disease surveillance officer, or the executive secretary in charge of the local health authorities. There is a process for management, there's a process for notification, and it is actually unlawful for any private hospital or public hospital to have a case or a case that looks like that of COVID and decides to probably keep quiet over it or to hide it. It is unlawful to so do. You must communicate the appropriate authorities. The use of face masks. I want to encourage Deltans on the use of face masks. Yes, a lot of arguments have been going on about this, but there is also a lot of support from the various countries that have had several cases of the COVID-19, and in the course of management, these countries have found that use of face masks would likely limit the transmission and reduce the transmission chain. Delta State, we are already in the process of producing face masks for our people, and when produced in the next few days, we will progress to distribute the face masks to our people free of charge. We're also in the process of, and we have actually started a food bank. By the grace of God, in the next few days, when we have been able to get enough, we will be moving the food banks to support our people in the various villages, towns, and wards of the state. I want to thank all Deltans that have made contributions thus far. There are 3 bank accounts that have been opened for those who want to support our activities as a state concerning the COVID-19. And it is my prayer that as many that think they need to support the less privileged, please do make your contributions, whether big or small. Nothing is too small and nothing is too big. I must truly thank our people who have made a lot of commitment and those who have already fulfilled their commitments, a lot of Deltans. And very soon, we'll be publishing the names of all those who have supported us in the course of raising the food bank. I want to also make our people realize that COVID-19 infection is not a death sentence. Obviously not a death sentence. A lot more people survive than those who die from it. And therefore, there's a need for cooperation. There is a need for us to support each other by keeping to the rules that have been set out. However, the fact that it's not a death sentence does not mean that we'll take it carelessly and then continue to go against the rules that we have all set for ourselves. When you're asked to do something, it's not just because it is to protect yourself, it is also for the fact that we need you to protect your loved ones, or the fact that we need you to protect every other person, apart from protecting yourself. We are working in unison for ourselves, for all Deltans, for Nigeria, and for the world at large. We must try to cooperate with ourselves in order to be able to effectively combat this virus and for us to be able to stop the chain of transmission. I also want at this stage to appeal to our people to stop all forms of rumor mongering. A lot of things are in the social media, and it is unfair when we go out to the social media to put up things that we know within our hearts that are not true. There's been a lot of insinuation concerning the fact that a member of the House of Assembly of Delta State has contracted this infection. That is not true, but that does not actually mean that anybody in government cannot contract the infection. Everybody is careful, everybody has to obey the rules, but it's important that things are put right. No member of the House of Assembly has contracted COVID-19. It's important that I put the records right. But whosoever that contracts it, it is not a death sentence, neither should any of such persons be stigmatized in any form. All we owe such persons is to pray for them for speedy recovery. I want to also let Deltans know that we are prepared as a state to tackle any case that does come our way in Delta State. As of today, We have 4 management centers, and each of the centers also has its isolation wards. We have holding centers in several other places where persons who are initially suspected to have contracted the virus can be kept on holding until samples are taken. All samples from Delta State are actually taken to ERA for investigation and confirmation. And when there's a confirmation, the persons will be moved to the 4 centers that we have at the moment. We have the center at the Federal Medical Center Asaba, built by the state, fully completed. We have the Central Hospital Asaba as a second center for case management and also for isolation. Ogara Teaching Hospital, a part of it has been dedicated, not within the main hospital, but outside the major building in the hospital. A part of it has been dedicated for case management and for isolation. And the 4th center is at the Warri Central Hospital. All those that need to be trained, both doctors, nurses, laboratory scientists, drivers, cleaners, and all other persons that will be needed in the case management, including pharmacists, have been trained. And if need arises, we'll train more persons. I want to urge us to please stay at home as has been ordered in the first 14 days. It is helping us as a nation, that is already proven. For Lagos, that has the highest number of cases, it's obviously been proven that this period of lockdown has helped to limit the level of transmission, and it has also helped them to track those who have been contacted and have been needed for investigation. And obviously, the world over, the stay-at-home order has obviously helped in the management of cases and in the tracking of contacts. The lockdown is not only happening in Delta State or in Nigeria, it is happening in many parts of the world. And as I know as of today, over 80% of the United States of America is actually currently on lockdown. But what do we do at this period of lockdown? It's not for us to go out to the fields to start playing football, because in that case, you're also congregating with yourselves and with other persons. And if anybody has it, it could be transmitted to you. So I want to urge families that this is a time for family reunion. It is time to discover ourselves more in the family. It's time for us to stay together. But very importantly, as we stay together, we must realize that this is a time for us to commune with our God and for us to call for His grace and His mercies. We are confident as a state that the mercies of God and His grace is sufficient for us. It's a time for prayers for our families. It's a time for prayers for Delta State. It's time for prayers for our nation, Nigeria, and for the globe generally. I want to thank you for listening to me and to urge that you continue to pray for our health staff, who definitely will be the line of duty to help manage patients, to help track contacts, to help take the necessary swabs that will need to be taken for investigation, for the drivers that will take samples all the way to ERA Specialist Hospital, and for all others who will be involved in either the case management or in the isolation centers. Pray for them. They need your support. They need your prayers. And I believe that the more we encourage them, the more fired up they will be to conduct their duties the way it ought to be done. May God be with us as a people. May God be with us as a state. God bless you. Any questions?
Yes, sir. Yes. Your Excellency, you have already admitted and as NCDC confirmed the state to have recorded one case of COVID-19. Can you throw more light to us, in as much as we wouldn't want to know the name of the person? I mean, how the person came into the state because we locked down the state. Did the person at any time traveled out of the state? Secondly, Your Excellency, do you have intention of extending the 14-day lockdown with this new development?
In the first instance, the person in question has been in Delta State for some weeks, so he did not just come in from another state during the course of the lockdown. At the moment, we are doing our tracking. We are getting more information on the incident case. And when we have more information, we'll be able to communicate to the state. But it is only the right of that person to be able to publicly tell us that I am infected. It is not for me to release the name. It is for me to pass information that needs to be passed to Deltans. But the person did not come from another state. He has been within the state in the last few weeks. Secondly, on the issue of whether there will be extension of the lockdown or not, we are not working in isolation. We're talking with ourselves. You are aware that Mr. President, in his broadcast, caused a lockdown in 3 states. All other states have done it on their own, believing and trusting that that will help to manage the level of transmission of the virus. At the moment, we're still talking with ourselves. We are talking with the Nigerian Center for Disease Control. I also know that tomorrow we have a meeting of the governors, this time not in physical but through teleconferencing. We have had 3 meetings of such already, and we have another meeting tomorrow. We'll be able to share ideas and know the way forward. But the next set of actions will only be determined by the advice offered by the Center for Disease Control and the Presidential Task Force for COVID-19. So we're sharing ideas with ourselves and we'll do what is best for the state. Thank you.